Thank you. Now I'd like to welcome to the podium Tom Symondson, who's going to talk to us about leadership in communicating oral health messages. In the time between planning the conference and today, Tom's role has changed from acting to the actual CEO role at the Victorian Healthcare Association, the leading health advocacy group in the state. Congratulations, Tom. Tom joined the VHA in 2012 to lead policy and advocacy work prior to being appointed acting CEO in October 2014. Prior to moving to Australia in 2011, Tom worked as principal advisor to the elected leader of one of London's largest and most diverse local councils. In this role, he headed the leader's office and was responsible for stakeholder engagement and policy development across social and aged care, public health, education, and urban planning. Thank you, Tom.
Thank you for the introduction. Yes, I'm Tom Symondson. I'm the Chief Executive of the Victorian Healthcare Association. Some of you might be saying, what's that? I did actually hear one of the former presentations mention that someone had won one of our awards, so I've had at least one shout out already. But we are the peak body for all of you, essentially, the community health services, the hospitals in Victoria, in the public sector. I have three broad reasons for being here today, apart from the most important one, which is Deb Cole twisted my arm and asked me to come along and talk to you all. The first reason is because I spend a lot of time in my office on Exhibition Street, in what a lot of people like yourselves might think of as an ivory tower, talking about policy and funding models and all of this kind of jazz. And it's really important to me to come and talk to groups like this who are doing the real work, the important work with our communities. Because if we don't do that, we forget why we're all in this game. And for me, this is not just a job. This is actually something I do because I think it's important. So that's the first reason. It's a little bit mercenary. I get to feel good. I get to talk to a group of people who do really important things. Thank you very much. The second reason that I'm here is to tell you what the VHA is. So the next time you hear someone's come from the VHA, you know what that is and why, hopefully, that's important. And thirdly, to talk a little bit about the way we get oral health. And I do know you're not all audiologists. I apologise. I'm told I'm supposed to say it oral, not oral, but I'm English, so give me a little bit of leeway. It's to get the message that oral health and dental care is an important part of the broader health environment. How do we get that message out? Because I believe it. I'm converted. I've been converted largely by Deb Cole ringing me up and telling me how important oral health is, and that's great. She's a great advocate, and she's made me into one as well. But how do we get that out more broadly? How do we get the GPs, the CEOs of hospitals, the surgeons, the nurses thinking that oral health is an important part of the broader health picture? So that's my third reason. So I do, because I was told you all have these little gizmos, I came up with some questions just to see if they worked. And I'm going to ask those Right, that was very quick. Okay, so the first question is, for each of these things, do you think they are important or useful indicators of public oral health need? So we've got how many people are on the waiting lists. We've got how long is the median time to treatment. Number of preventable dental hospitalizations, prevalence of oral disease. This is the trick question. Number of toothbrushes sold in 2014. Unless you're from Colgate, that's not that important. Size and distribution of the public oral health workforce. So let's see how this goes. Is there some music? Do I do a dance? Oh, there we go. Wonderful. Because I know I'm being videoed, I'm not going to do a dance. What happens now? Where are the answers? There they are. Okay, great. You all listened to me. Number 5's not important, but I am very disappointed in you all. You have said number 1 is size of the waiting list is not the biggest issue in the world. How long you're on it, that's what matters. But everybody thinks the waiting list is important, so you can't really be blamed for that. And the other things are also useful measures. These are the tools of my trade, evidence that I can go to politicians with and say, look how long people are waiting on the list. You need to put more money into the system. So the next question How many of you, if I pointed at you, could answer the question of how many people are on the waiting list? That's a yes or no. Median time to treatment, where's that sitting? Number of preventable dental hospitalizations, prevalence of oral disease, and size and distribution of the oral health workforce. And don't worry, I'm not going to pick on you, probably. The tension, I can't bear it. Wow. Because do you know what? I don't know an answer to a single one. That's pretty impressive. I left a piece of paper that had all of the answers on it at home. Otherwise, I could have told you. These are essentially the kinds of things that I need, people like me need the answers to get our case across. But it's also useful for all of you to know the answers to these questions, because it means that when you're out in the community or talking to other clinicians, you can actually say, this is why we need more funding into the Child Dental Benefit Schedule, or we need to keep access to it as public providers, for example. So the next question is about you as individuals, as stakeholders in the health system, thinking from your perspective, how responsible are you as an individual clinician for advocating for good public oral health care, from very to not at all? You're answering this one much more quickly. This is obviously much more straightforward for you. Marvellous. I can leave now. I don't need to do another thing. Very. Apart from those 3%, who are those? Don't worry, I won't ask you to put your hand up. And the last and most important question, given that you've all basically said, oh no, what did I do? Huh? Oh, okay. Well, I was going to say there was another question. I thought there was. There is. Oh, all right, well, you'll just have to put your hands up for this one. Do you have enough time as a clinician to advocate for better public oral health care? Put your hand up if you do. Wow. Somebody at the back, one person, not a single person, apart from that very brave gentleman at the back, thinks that you have enough time to advocate for better public oral health care. Well, now I've got a really tough challenge. So, what happens now? There we go. So I've already told you about the VHA. We are the representative of all of you and the people that you work for. I saw the last presentation was Monash Link Community Health. I think the next one's North Richmond. We represent both of those organisations, as well as DHSV, as well as all of the hospitals, community health services, bush nursing. We work on representation of the views of those organisations, and we deliver policy work. We put together policy statements, position statements, discussion papers, and we've done quite a lot of work recently on oral health, partly because so many of our members deliver oral health services, and also because the federal government seems, at least from recent behaviour, to not think it's all that important. And this is a challenge for us because we don't agree with them. So at the big picture level, these are the challenges that we're dealing with, that we're seeing. We all talk about person-centred care or patient-centred care. That's dying. It's about consumer direction. It's about co-design. These are the challenges that all of you as clinicians and the executives of the hospitals and of the community health services are dealing with. Consumer direction is the thing of the future. It will be about people choosing how they are treated, not you choosing how to treat them necessarily. You will be partners in that work. Measurement of patient experience. So people aren't going to be asked whether they were satisfied with the care they received anymore. We're not just going to check that they got better. We're going to say, what was the lived experience of that care? How did you feel about the way you were spoken to, or the food? Eastern Health does a lot of work on asking people how they like the hospital food now, and apparently they respond to that by changing the food that people receive. This is not the kind of question we ever used to ask, because we knew that the answer was, it's horrible, and there's not a lot you can do about it. Now we actually ask those questions, and your patients and service users will be asked these questions. How did you feel about the way that you were interacted with? How did you feel about the way that the other clinicians knew about what you'd experienced when you were having your whatever sort of oral health care you were having? So we've got to have that in mind. Delivery of care out of traditional hospital settings is growing. This is the background against which all of this is happening. Your hospital care is incredibly expensive. Demand is growing very, very quickly. So the cost is growing very, very quickly, but the funding is not. So more and more often, people like you are going to be incredibly important in making sure that people aren't ending up in hospital. And making sure that we do prevention really well out of hospital settings. Sorry for those of you who work at the hospital. It will still be incredibly important, but more and more we'll be seeing services delivered in the community. You've got to be innovative, and the last bullet point really just says that we've got to integrate things. So the primary healthcare networks, for those of you who've heard of Medicare locals, have you heard of Medicare locals? Yep. So they disappear on the 1st of July, more or less. They'll still be around, but they'll be defunded. They'll be replaced by primary health networks. This is because the federal government thinks it's really important that you talk to the GPs and the GPs talk to the hospital and that the hospital talks to the post-acute care and all of that kind of jazz. We don't do that very well in Victoria, and the primary health networks are a way of trying to drive that. So integration is really important. And I really just raise those things as context for the challenges that we're dealing with in the health system as a whole and the challenges that you and the people you work for are dealing with. So why is this even vaguely pertinent to people in oral health? Well, it's important because we as an organisation and you all as individual clinicians need to engage with the rest of the system. I think it's probably fair to say that in the past, oral health and dental have been seen as an add-on to the broader health system. We tend to focus on our tertiary hospitals or our aged care programs or our whatever, prevention. And oral health, and I've got a sort of a slide of the kinds of strategic documents that we see. We see an action plan for oral health promotion on the left there. That's a plan that's taken in isolation. Oral health tends to be seen from a strategic point of view as something that we do as well as, not as a part of, and that's a massive challenge. So how do we make sure that oral health is seen as part of the strategic framework? How do we make sure that when we're planning for a new community or a new suburb or for increased infrastructure in a growth area in the metropolitan area, that we don't just plan for a new hospital, we don't just plan for private GPs and even private dental, but we're also planning for public dental capacity, because these are the areas where you're going to be most in need. How do we make sure that when we build a new community health service, we put some dental chairs in it? I only learnt the other day that a dental chair costs $250,000 to put into a new building. I was absolutely gobsmacked. I had to say I thought it was a chair with a light and a sink in it. But they must be much more complicated than that. But those are the kinds of things that when you are planning, you actually have to make sure you plan for. Otherwise, we'll end up with new communities with no dental chairs in the public sector because nobody thought about it. We see this quite a lot. How do we make sure that dental and oral health is catered for in the funding model? So I mentioned the child dental benefits schedule. We almost lost out on that at Christmas. We almost ended up not being able to access that as public providers. It was going to be left only to the private sector. It's only because of advocacy by people like me and Deb and in other states that we've managed to stay able to access that money and treat children in need through the public system. And partnerships. So in terms of getting this message out of why this is important in this modern world of more out-of-hospital care, greater emphasis on the patient experience and coordination and all of those things, we can only do this if we have good partnerships. So I'm going to show you a story, a news story that appeared in the Herald Sun on page 2, no less, and there are only 2 reasons you get on page 2. You either have a nice picture of some attractive people doing good work, or you've done something horrible. So usually if I was on page 2 of the Herald Sun, I'd be very, very worried. In this particular instance, I was very, very happy. Now, if that photo had been of me, this was about the potential to lose the federal funding on the child dental benefits and a national partnership agreement on public dental. If the photo had been of me, we would have been on page 20. Because I was able, attractive as I may think I am, I don't hold a torch to this particular setup. Because we were able to have a partnership with DHSV and a very kind dentist and a child and her mother, we were able to make this story real. We were able to say, we're not just asking for more money into public dental, we're asking for more money because this little girl needs you to help her. And that has a lot more traction, and politicians love this stuff because they get to go, well, Treasury has to give us a bit more money because look at this picture. And that partnership between us and DHSV meant that we were able to make this happen. And this is just the start, because for me, we need to have that partnership with all of you to try and start telling this story in every opportunity that you get. Now, earlier on, I asked you the question, do you have enough time to advocate for good public oral health care? And you all said no. So how many people do you speak to every day? How many people do you see who are clinicians of other kinds? If you're all working in, or many of you are working in community health services, how often do you see a speechy? How often do you see a physio? How often do you see a CEO of a community health service? Actually, and it might not be very often, I apologise if it's not, but I've been to a lot of these places and you tend to be working in quite close quarters. How can we tell this story every single day? And I don't want you to be one of those boring people at the family barbecue that doesn't stop talking about what you do at work all day. But there are plenty of occasions where you can. And actually, the kinds of stories that I would love to be able to tell, you all have. I heard one the other day. I was speaking to an MP from Geelong who got quite teary when she was telling me about the 80-year-old woman who came to her and said, I have not been to a dentist in, I can't remember, 10 years, say. Her teeth were all wobbling. She still had them, but they were all wobbling because she had not sought treatment, because she couldn't afford it and she thought that there was no free treatment available. And the MP was able to pull a couple of strings and that person got some public dental treatment. It shouldn't have to be like that. Those are the kinds of stories that all of you have that help people like me not have to rely on those boring figures at the beginning that I don't know the answer to, the 20,000 people on the list or whatever it happens to be, or the median waiting times. So in terms of getting the message out, it's got to be a partnership. It's got to be about people like me going to Parliament House in Canberra and saying how important it is that we fund oral health care. But it's also got to be all of you saying, well, here's the story of the person who couldn't go out in public anymore because she was so embarrassed about her teeth and she didn't know that she could seek public treatment. Or she couldn't seek public treatment because there wasn't any in her area. So how do we build that? And I did actually want to ask you the question, and it says audience discussion, it's not that at all, it's just questions. This is where I would normally say, have you got any questions? But the real challenge back to you is, I have a question, how can we do that? How can any of you actually come up with a way in which you can, apart from being the boring person at the barbecue, advocate for better public dental care? And if you don't come up with anything, I'll look at the person who looks the most enthusiastic, come up to them and point. Because there's got to be something in this room, there's got to be a positive example of something that you can do individually to help people like me advocate for all of you and the importance of what you do. And I'll play some music. There's one. I've seen you smiling, so I assumed you would have something to say.
Local newspapers pick up these personal stories, and if you have a patient that has a particular need, ask them if they volunteer to make their need public through the local newspaper. And they have journalists available. You ring them up, the leader or the star, and they'll send out a journalist with a camera, and yeah.
So this is actually really effective in local areas, and it's best to do it in a coordinated way, so to talk to the community health service or whoever it is. But it's really good in local areas. Local journalists love this stuff, as long as the message is right, because it can end up as being critical and, oh, it's the community health service that is in the wrong. Actually, it's the federal government that needs to fund this. Whatever, as long as the points are really clear, that's the kind of thing that we do, and that's the example that I showed you earlier. But it's a good one, because local journalists in rural areas love getting on that kind of bandwagon. Just have to be careful, because they can be like Pandora's box, and once they're out, you can't get them back in again. Any?
Time, we can only take one more, I'm afraid.
That's all right.
Thank you.
Any others? Really, if I've achieved anything with this, it's to tell you that people like me exist, and we can get the message out. And you have a friend. Oh dear, that's a song, isn't it? You have a friend in me I have a lovely baritone, but I'm not going to show you it today. You have a friend in the VHA. We think that oral health is incredibly important. We are advocating on your behalf. But if we need help, we will come to you, and I would very much appreciate it if you took up the challenge. So,
And Tom,
thank you.
would you be happy to accept emails from members of the audience?
Follow me on Twitter. It was on the. I can show you. I can show you me.
I'm sorry, we're out of time.
Oh, bum.
It wasn't you, it was this lady.
What did I do? Where's my... I've broken it. So anyway, my back one. There you go. Follow me on Twitter if you wish to. Don't ask me too many challenging questions because I'll get worried and not know how to answer them. But feel free to either follow the Victorian Healthcare Association or me. And that's it. Thank you very much.
Thank you. Thank you very much, Tom.